Hi, this is Dr. Philip Cordova and Dr. Natalie Cordova here at Core Chiropractic in Houston, Texas. She's going to be my model today for TMJ. So this is one of those things where patients have no clue that chiropractic can help with it. And you know, some chiropractors aren't as comfortable taking care of it, but I've seen a lot of great results, especially in the last few years with it, where patients come in with a jaw that, you know, it clicks or one side opens up before the other one. I had one guy where literally to open his mouth, he had to do this, like, to open it. So back and forth, side to side, in order to get that mouth open. We've had one patient come in recently where it was either this helps her or she's going to end up having surgery. And the surgery for her would have been breaking the jaw, resetting it, and then putting it all back together. So that's what she had to look forward to. So she was willing to try anything to do that. You know, patients are coming in with mouth guards, or their teeth are being ground down so that they can be level. So there's a lot of different treatments for it. But one of the things that I'm doing is that we're going to do an exam, a consultation exam for her first. So we do check the whole spine, not just the jaw. We're going to look at the jaw as from the standpoint of how is the skull situated. So very often there's a head tilt. You know, they come in, it's maybe not as obvious as that, but it seems that obvious to us, you know, that they're very tilted. And then of course we'll check the jaw itself, so to see as it opens, you know, do they open up evenly, or is one stuck as it opens and then there's a little delayed, or is there a big pop or crack with it? And so what I'll do is I'll come in here and I'm going to feel the back of her skull, and I'll show you an adjustment here for that in a second. And then I'm also going to look like through the muscles here and find areas that are stiff. Now, almost always the problem is that one side is way stiffer than the other side, and that's what we're looking for. You know, which one doesn't feel right, which one's tighter, and then I'm going to work that muscle all from the outside. I don't put my hands inside your mouth, although that is a treatment that is sometimes out there. I'm able to handle all of it outside and show you some of the things that you can do at home to help with that as well. And then once I determine which side of the jaw is out of alignment and not moving, then I can do the adjustment to push that back into place. So these people are having a lot of pain when they open up their mouth, but the adjustment is still pretty comfortable and, well, kind of described as wow, and that's kind of wild. I didn't realize that my jaw could do that. But it's getting the skull situated correctly, and then getting the jaw situated correctly, and then working on the muscles to help that out. So very often it's not the same type of treatment as you would go through with a regular treatment plan. You may not need to come in 3 times a week for this kind of problem, but you may have to come in a little more frequently at the beginning in order to see a change there. And some of the changes we'll look for is it doesn't hurt when I open up my mouth, or I'm now able to open up my mouth more smoothly, or the headache I used to get because my jaw was stuck all the time is now going away. So I'll demonstrate here that in a second, but did you have anything you wanted to add to that?
Yeah, a lot of times when you do have jaw problems, it's because one side is stuck and the other one has to move or moves inappropriately in response to that. And so this is the symptom side, but this is actually causing the problem. And so that's what we're assessing. And that's also a wow factor, is like, I didn't realize that this was so painful. And a simple test you can even do for yourself is, 1, look in the mirror, see if your jaw opens and closes smoothly. 2, you can palpate those muscles that cover that jaw and feel, is it tender, is it sore? Because that's oftentimes the reflection of the structure underneath. That joint is not moving well, and so it can move forward, it can move back, it can get stuck, it can also go lateral, side to side, and that's what we're assessing, is how does that go. And you may not be able, most likely not be able to figure out that misalignment, but you can feel the symptoms of it. You can feel that tenderness.
Yeah, and so people will get TMJ issues for a lot of different reasons, but some of them are very simple. One, they got punched at some point and the jaw went out, or they were at the dentist's office and their mouth was open just a little bit too long and it stiffened up. Some people are just perpetual teeth grinders while they sleep, and so they're having some of these same issues. But it's occasionally traumatic, but most of the time it's something that's built up over time. And so we'll take the x-rays, we'll see exactly what's going on, but very simply it's work on the muscle, put things back into place, and you'll see a big change in how you feel.
And things to take care of it just normally is watching how you eat. If you're only chewing, or you're a gum chewer and you're only chewing on one side, that's causing imbalances, and that is going to cause you to have an issue with your jaw.
Okay, I'll demo here an adjustment, and then if you have a TMJ issue, feel free to schedule a consultation with our office. We do consultations at no charge. It's about 15 minutes. We'll talk with you, look to see if your TMJ issue is something we can probably help with. If it is, then we would recommend doing the examination and x-rays to see exactly how bad it is, and then we can start treatment. All right, thanks. Okay, so as I'm demoing the jaw adjustment, what I'm looking for is that I'll very often see that their head is tilted one side here, or they'll appear more turned. And so if you're looking at the midline here, we want to see, do I see a lot more of her face on one side? You know, not so obvious, hold on one second. Like just a little bit there and a little bit here. It'll be subtle. Or am I seeing that her head is just tilted off to one side like that? So she's not too bad there, you can see it. But to adjust, let's say the things are tilted this way, I'm gonna come in, I'm gonna grab here at the base of her skull. She's gonna relax that muscle here for a sec. I'm gonna contact right here into her skull, and then I'm gonna do a line of drive that's there, and it's just gonna be a quick relax that muscle. You can see this muscle tighten up, right? You know she's bracing for impact here. And then we just do a little adjustment into that spot. Now with the jaw, I'm gonna feel right here where the jaw connects, and she can open her mouth and close it, okay? And so I can feel this side's a little bit tighter, and I'm gonna come into these muscles here, and so I can feel a big knot right there. You feel that one? And so I'm not gonna go across her muscles like that because I'm picturing that the muscles here, I don't wanna go across that way, I wanna go in line with the muscles. And so I'm gonna help push those back down into place like that. And so as I find little spots there, I'll be able to do that. And that's why I think this is one of those things where you'll wanna do it yourself as well, because you can probably inflict way more pain than I can inflict on you. And so once I've decided I'm gonna adjust that jaw, then I'm gonna bring her head back that way. Just gonna relax it again. I'm gonna contact right into there, contact my hand into there, and then it's gonna be a little quick motion just like that to push that back into place. And then we'll open up again and retest. Very good. And then we'll check those muscles again. And there you go.